Welcome to the Hospice Education Podcast. Today we're going to be exploring the values of care, which guide everything we do in our hospice setting. The values are just more than words, they shape how we interact with patients, families, and each other. Today, joining me is Siobhan Workman, who has extensive experience in embedding these values into practice.
Thank you, Leanne. It's a pleasure to be here.
Okay, so let's start by just talking through exactly what it is we mean by values of care.
Values of care are, I believe, the principles guiding our actions. So that's things like compassion, dignity, respect, and collaboration. And that's not necessarily just with our patients, but it can also be with our colleagues and our peers. And these values ensure that care is person-centered and holistic.
Great. So thinking about our specific setting that we work in, why are these values so critical in palliative and end-of-life care?
I think the reason being is because at this stage, every interaction or contact that we have with patients and their support network matters. These values help us maintain what we like to think of as humanity and empathy, even when it can be a really challenging situation or circumstances when emotions are really fraught. And nurses are introduced to these values through the 6 C's of nursing,
Okay.
which act as points of focus, and they are known as the 6 C's, being care, compassion, competence, communication, courage, and commitment. And as Dame Cecily Saunders famously said, the value of caring is because you matter, because you are you. And one of the eminent nurse theorists of the 20th century, some of you listening to this may know her, Jean Watson, wrote about it in her theory of human caring. What does it mean to be human, and what does it mean to care?
Amazing. Very valuable insight there. So perhaps we could delve a bit deeper into some of those specific values that you've just touched on, maybe starting with compassion. What does that look like in practice? How do we embed that in what we do every day?
Okay, so sometimes we think of compassion as something that we feel, and actually, that means about being present and truly listening. Or, as I recently heard last year, somebody actually described that as authentically listening. So it's not just hearing the words that people are saying, it's actually thinking about what they're saying, the situation, and that moment in which you hear those words. And it's also about acknowledging emotions and responding with kindness and
Yeah.
empathy, even when time is limited. And as healthcare professionals know, time is something that is really precious for us. But similarly, on the other side of the coin, it's really about being other orientated so that those what we call therapeutic relationships can be built, and they are often based on rapport and trust that we have between us as the healthcare provider
Mm.
and the people who are receiving that care from us.
Yeah, it's so clear that compassion is hugely important in how we deal with our patients and their families every single day. But something that's also massively important, particularly in end of life care, is dignity. So let's talk about how we can embody dignity in our day to day roles.
Okay, so we often think of dignity as, you know, preserving people's privacy, but actually it's also about respecting choice as well. For example, it's about ensuring that patients have control over the decisions about their care and maintaining their sense of self, particularly when someone is facing a life-limiting illness or if they're at that end of life stage.
Mm.
Their independence and their sense of worth actually diminishes, and they're beginning to feel, what value is there for me left living, so that they can make the most of the time they have left and prepare to die with dignity, as we sometimes talk about.
Yeah, yeah. Something that we touch on through a lot of the training sessions that we offer to the healthcare industry is how we deal with dignity in all the
That's
situations
right.
that they come across.
Mm,
Another massively important thing, particularly dealing with end stage, end of life palliative care, is collaboration, particularly around other healthcare professionals. So how is that value something that you yourself and all our colleagues can ensure that they are delivering?
okay. So, collaboration in this sense means working as a team,
Hmm.
and that's not just with your other colleagues that work within the healthcare arena, but actually it's also in collaboration with the family and with the patient. It's really important that the collaboration is there and is present in order to create and implement care plans that actually respect everybody's input.
Hmm.
And we just briefly talked about the dignity aspect as well, about respecting choices, and that's where the collaboration really comes into its own, so that the patient is placed at the centre of the care surrounding them. And we've often heard the phrase in the healthcare environment, no decision about me without me. And that's really where the collaboration comes into play. In other words, that care is grounded in shared decision making.
Hugely important, isn't it? Okay, so we've touched on some of the values that we spoke about at the beginning, and living these values sounds ideal in
Mm.
theory, but what challenges could exist in real life scenarios in trying to ensure that we uphold these values every single day?
Yeah, I think you're right there, Leanne. We often talk about the values, but actually, in our day-to-day practice, how are they, how are they shown, and how do we feel that we are actually honouring those values? So, I think some of the challenges come in the form of time pressures, which we've touched on.
Mhm.
There would also be issues with emotional fatigue or burnout, as we
Okay,
sometimes refer to it. And the other thing is, everybody's bugbear is the competing priorities.
sure.
So it's where the care is very task driven, and that comes into conflict with the desire for us to deliver that person centered care.
Sure.
And sometimes these values do clash, and that is human nature, but it's actually recognizing um, and respecting autonomy so that we can make our decisions, but ensuring that those decisions are made, preserving patient safety.
Yeah.
Um, and the other thing, which I think is really important, which can be a challenge for clinical staff, is around the area of making assumptions about a person's cultural beliefs towards illness,
Okay.
dying, or death. And we're all individuals, and we each have our own thoughts and beliefs around, illness, dying, and death. And the assumptions are made when people don't ask questions,
Yeah.
you know. Um, and maybe that's because they're afraid of getting it wrong,
Yeah.
or they're simply not interested and they lack that sense of curiosity about the person that's actually there with them,
Mm.
So we should always, be open to being other orientated and to having that curious mind
Yeah.
about each and every one of those
Yeah.
people we come into contact with.
And have you got any suggestions on how, the healthcare professionals can overcome some of these challenges that they might face in upholding values like this?
Yeah, I think one really good way, and we give unfortunately a lot of lip service to is reflective practice,
Okay.
and that's not necessarily in the form of written words. It just can be if you're in the car at the end of your day or at the end of your shift, just actually giving yourself that space and time to actually think, was there anything particularly about today that I struggled with? Or was there particularly something that I thought that's actually a really good point? Let me see if I can take that on board and see how it would, reflect in my practice. And, and continually asking ourselves, what do I understand as the values of care? What do they mean to me personally as an individual, but
Yeah.
also professionally as a healthcare professional? And then once I recognize and understand what those values of care are, am I actually honouring them? So it's continually looking at the practice that, practice what we preach, basically.
Yeah.
Okay. And I think one of the other areas that is hugely beneficial is that of peer support.
Mm.
We can share experiences, we can talk through scenarios or challenges that we may have faced in our practice. And that open communication, that two-way communication process is really valuable in helping, to embed these values into our practice.
Yeah. I mean, you've got extensive experience in the industry. I'm going to put you on the spot here now to sort of humanise some of these values a
Yeah.
little bit. In your experience, which values do you find the easiest to uphold, and which ones do you find a personal challenge?
I would say that compassion and empathy are probably the foundational values.
Sure.
Um, Dignity can be challenging to uphold when you're in a high pressure
Yeah.
environment. Um, and it's finding that balance between them. But for me, I would definitely put the compassion and the empathy
Yeah.
as the underlying values to my practice.
Amazing,
Yeah.
amazing. Well, I really appreciate you sitting down with us and sharing your insights. For our listeners, now's time to take time to reflect and have a think about some of the things that we've spoken about. Which values do you perhaps find the easiest to uphold, and which ones do you find the most challenging? Have a think about how these values influence your daily decisions